morning, everyone. I'm Cindy Gordon, and I have the privilege of being the Patient Care Executive here at Adventist Health in Rideout. And this morning, I have the honor of following our lactation consultant, Mindy, around. She's going to tell me about what she does, why we should be proud to have her on board, and some of the ways she serves our community. I see you're certified. Tell me a little bit about your certifications.
I am certified in maternal newborn nursing, and that is part of my nursing job. And then for my lactation job, I am an international board certified lactation consultant.
What do you like best about your job?
I love connecting with the families and getting to share this really important time in their lives with them. I get to do a lot of education with them and teach them about their babies. Most families want to do a really good job. It's a wonderful time to work with them.
Can you show us around and maybe show us a room and where your office is?
Yes, that would be wonderful. So we have private rooms, which is really, really helpful whenever we're learning something new. If we can decrease distractions and inhibitions, that really supports the person to learn something more easily. And then we have sleep couches at the bedside there for the support person, so someone is able to be with mom at all times. And that's really helpful when we're giving new information for more than one person to hear it. And then we have private bathrooms, and the babies stay in the rooms with their moms. We try to room them in 24 hours a day. We have implemented skin-to-skin care immediately after delivery, which really promotes breastfeeding and bonding. And then we have started delaying our bathing, which has really improved our breastfeeding rates as well. When we separate moms and babies to bathe them, we find that the babies become distressed, the moms are distressed, and they kind of go into this deep sleep, and they're not very interested in feeding. So keeping them unbathed and close to their moms has really improved our breastfeeding rates.
So that's very cool.
Yes. So we have pumps available for the moms to use while they're here with us. And also those can be kept at the bedside in the NICU if the baby's going to stay longer past mom's discharge time. And then we're able to order pumps for moms to use at home as well. We don't advocate for early pumping. We'd like to initiate breastfeeding, but sometimes there's challenges that prevent that from happening, or we need a little extra support. So these are the pumps we have for the moms to use.
Okay, Mindy, so tell me what a typical day for you is.
Okay, a typical day, I usually see all the families on the floor. I go down the hallway and I ask them about their feeding goals and how those are being met, and if I can support them in some way. A lot of times it's just fine-tuning what they're already doing, helping them to find a better way to do what they're doing. Luckily, breastfeeding doesn't require a lot of tools. We do lots of just hands-on teaching, lots of support right there at the bedside. If we identify that they have needs beyond what they have available to them, we can order pumps for them to use at home. And then we provide them with a discharge pack that has information about expressing milk, storing milk, potential issues they may have with breastfeeding and how they can remedy those, who they can follow up with, and then making sure that they have the tools that they need to be ready to go home. We have just started doing the post-discharge phone calls, and I'm participating in those, but we do also provide our office number, and all of the families can reach out to us once they go home. This is a brochure that we give families. Usually they're available in the physician's offices, the OB offices, prior to moms coming to us. So this is one way that we can access them and give them information about breastfeeding and planning ahead for what their breastfeeding journey looks like. So we're able to talk about just the basics of breastfeeding, the benefits, some very basic information about how to breastfeed, tips for being successful, and then on the back it talks about where they can get help within our community and who they can follow up with if they need some extra support.
So you helped design this?
Yes.
Okay.
Yes.
You were the content expert.
Yes.
Okay, great.
We have found that it's really important for women to see themselves, and so we tried to find some pictures that showed some diversity. A lot of times people don't feel that they're represented in the information that's given, or they can't access care that appeals to them and meets them where they're at, what their goals are. So be more diverse and make sure we reach our different populations of patients.
So Mindy, tell me about the effects of COVID, kind of what has happened in your world. We mentioned earlier that initially you saw an increase in breastfeeding, and then because of other factors, like you described, the formula wasn't available, that caused some concern and all of that. So what else has happened with our moms?
So initially we saw rates go up. Women were concerned about accessing formula and different things when they went home, and then they had a lot of privacy while they were here without having extra family members here and lots of interruptions. And so we saw those rates go up. It was really wonderful. And then What also went up, though, unfortunately, was postpartum depression and anxiety because of social isolation. And so many of these delivering experiences didn't look like women expected them to. No support from moms and sisters and girlfriends, and they were isolated at home. A lot of times that impacts us because those women end up visiting our ER again and getting follow-up care there and getting support there. So our program actually, not only do we see them when they're here, but we see them if they revisit us also.
Yeah, no, that's really important. And again, that goes back to being aware of the whole effects of what has happened over the last year on the health of our community.
Yes.
Not only the physical health, but the spiritual and the mental health.
Yes.
That isolation can cause.
And the virus was so novel, there wasn't a lot of information for families about whether or not we should be encouraging them to breastfeed, right? So initially there was some uncertainty, and now we know that the absolute best way to protect their babies is to breastfeed them, even if they are positive for COVID themselves.
Oh, really?
Yes.
Great.
We just want them to do good hand hygiene and wear their mask. Yep.
Okay. If you could ask me for one thing to make your job easier, what would that be?
I would love more lactation support for the night shift. That would be my big ask, because that is often when we fall apart, right? Moms are tired and sleep deprived, and we have our babies are awake a lot more at nighttime, and we tend to have fewer resources here at nighttime. So that would be my big ask. I would love lactation support for the night shift.
So you mentioned earlier that you get invited to birthday parties.
We do. We get wonderful feedback from our patients and moms that we've supported through their breastfeeding journey. So we get thank you notes, and we get lots of words of gratitude. And then sometimes when they make their first year, we get invited to birthday parties. It's very exciting. It's fun.
Not only are we supporting them at the beginning of their child's life, but if they come back to one of our other points of entry through the ED, or they need help out in the community, then you're still available to help connect them with the services.
We are. They are able to call our office anytime, even once they're discharged. We're still available to them for phone consults and questions and conversations. We have our Facebook group that they're able to join and ask questions there as well. And then, of course, as they come back and visit our providers, our pediatricians or our obstetricians, they can refer the patients to us. Different programs that we have, our homeless program, they are able to access our care that way too. We don't have a traditional outpatient program. That's something that we're still working on. Try to reach them wherever they're at if there's a way to help them. And we can always refer them to our public health services and our WIC services, which we work really closely with those folks.
Sometimes in our community, our patients don't have a home. They don't have a regular home. They move around.
Yes.
And that for those patients that we can really help them get their baby off to a good start, because they were ideal candidates. So I thought that was interesting.
So a lot of times we tend to think that families that aren't well prepared are not well prepared to become breastfeeders, and they are exactly who we should be supporting to breastfeed, because you don't need access to running water or soap. You don't need a stable environment to breastfeed your baby. It can be done absolutely anywhere. It's always the right temperature. It's always ready to go. And then on top of that, if you don't have access to good health care and those sorts of things, sometimes you have issues with becoming unwell, and breastfeeding supports good immune health and immunities and provides antibodies for babies. So it's a really wonderful start for all of our patients, not just the families that are prepared to have a new baby.
Yeah. I love how all those services are connected.
They are.
How we have so many fingers in all parts of our community for our trauma, our STEMI, our stroke, our whole perinatal services, the street nursing program, and how we can support our community in so many different ways. So that's really exciting to hear.
We spend a lot of time trying to do outreach, which of course has been limited this year, but lots of baby fairs. In August every year, we co-host with Tri-County's Breastfeeding Alliance the Big Latch. So our moms from our moms group will meet at the park, and they simultaneously nurse their babies, and that's part of a worldwide breastfeeding week that we participate in August. So there's all sorts of exciting things out there.
So thank you for what you do.
Thank you.
And really appreciate it. Thank you for sharing your time with me. I know it's not easy.
Thank you.